Hi, this is Yamini Oseguera Bhatnagar with Hive, a hub for positive sexual and reproductive health. I'm here in downtown Durban at Match Research with Noni, Tulile, and Spa of the AYAZAZI study. Guys, will you introduce yourselves?
Hi, my name is Nandleni Popengu, Noni for short, and I'm the research interviewer for AYAZAZI.
And I'm Tulile Matenja, the project coordinator, making everything happen.
Okay, I'm Spamandla Kumbe. I'm also an AYAZAZI interviewer.
Cool. Tell us what AYAZAZI is and why is it important right now here in South Africa or here in Durban?
Okay, thank you. AYAZAZI is derived from a Zulu word meaning Zazi, which means knowing themselves, and Aya is short for adolescents and young adults. So what the study is doing, we're trying to better understand the HIV risk among adolescents and young adults, and we also want to know what is it that they think about participating in HIV studies, research studies. So we're looking at young people who are 16 to 24 years old, and they should be living in or around Durban, and they should be HIV negative or should not know their HIV status. Those are the people that we're recruiting into the study. So what the study is doing, like I had said, we're trying to better understand the HIV risk among adolescents. So what we're trying to do is to link socio-behavioral data to clinical as well as genetic data. So what we're doing there, we call the people and we ask them all sort of questions, trying to understand their social as well as their behavioral, part of it. And then we also take some specimen to actually look at the clinical data. So what we're looking there is to see if they have any STIs that could lead to them, like developing HIV. And we also have the other part, which is the genetic part, where we're trying to look, is there anything unique about an individual in terms of their genetic makeup that could put them at an increased risk of actually getting HIV. So that is what is unique about the study, because it's trying to link all these different aspects of data together. And so we're trying to look at an individual as a whole to say, okay, this is what goes on in one person, and could there be any other factors that could put you at risk of contracting HIV? But Noni and Spa can add more on that.
I think what is special about AYAZAZI is what Tulile has mentioned, is the fact that it looks at a person as a whole, and it focuses on the young adults, of which another special thing about our study is that we have like a special setting. It's not like a normal clinic that you walk into, and when our participants come inside, they feel relaxed, and it's so welcoming for the youth. And for the fact that, as she has mentioned, that it looks at a person as a whole, it looks at your genetic makeup, it looks at your emotional well-being, because as we know that if a person, like your emotions can contribute to your immune system. If like you are unhappy most of the times, your immune system can be low. And if you do become in contact with the virus, you are most likely to contract it, and that can put you at high risk. So during the visits, we ask the participants questions. Okay, we have a questionnaire which is about approximately 60 minutes. And when we are doing that, it has different kind of questions which will ask you about your emotional well-being, your social lifestyle, your sexual life, and with that, we have a nurse and we also have a social worker, so that if anything is triggered during that questionnaire, like when it comes to your emotional well-being, because we also ask even about physical violence, sexual violence, we have a social worker who can counsel you after that session. So I think that is very special about AYAZAZI.
That is very special, and it's not being done in many places. Spa, did you have anything to add?
Yeah, on top of what Noni is saying, yeah, when they come here, we ask them questions, we screen them for STIs and HIV. When you find that they have STIs, we refer them to the clinic down on the ground floor, so that they will get treatment. Yeah, I think that's what makes it more special. It encourages them to get treatment and then protect themselves in future.
Do you guys have any thoughts on where you are located? So right now we're in Commercial City in Durban. Is that location a good location? Is it a bad location? Like, what do you think about that?
I think it's a good location because seeing that we're in the city, we get in contact with different people from Umlazi, Wamashu, and so on. So we get to find a variety of people.
Yes, it's central. This place is central, and those people coming from different townships and different urban places. I mean, some of them are unemployed that come here. Some of them are students. Some of them are looking for jobs. Some of them, you know, they do different things, so they don't come from the same category. It's very broad. So we get to consult different type of people.
You guys began enrolling a few months ago, right? Will you tell us a little bit about what your experience has been trying to recruit for this study?
We started about 3 weeks ago, 4 weeks ago. We started on the 17th of September, and we are at 35 as of last week Friday. So it's been really, the reception is really great in the sense that we're finding people do want to participate in HIV, in research in general. And I think the reason they've never participated mostly is because no one has ever approached them about participating in HIV studies. But what is so, you know, when you approach people and you tell them about this kind of study, to say, okay, this is what we're doing, we're interested in young people, and this is what we're going to do, we'll screen you for STIs and things like that. And some people, you find that they're interested because they'll get to be screened for STIs. Some people are like, okay, I want to join because I want to have an STI test, you know, those kind of things. And some people want to join because they want to have an HIV test, you know. And also some people just find that, okay, there must be something about us youth that is making you guys want to look at the youth, kind of focus at the youth. So we want to be part of that, to understand what is it that you guys, there's probably a reason why you guys want to work with us, so we want to be part of that, you know. So which is really kind of heartwarming when you see people coming in. And when they do come in, I think what is also good is that we kind of like have a youth-centered approach. Like you can see, we got a game room where they come, we got so many facilities where young people, they come. Also the interviewers, it's young people that they can actually relate to. So when they do the survey, because sometimes you feel that the survey is kind of invasive, so they get to relax and they're able to open up to them. So it's all those things that we find are really helpful, and people kind of like them. So when people come here, they don't even know about the reimbursement, the money that they'll get. You know, they kind of come because of that. And so when you tell them about the bank, they're like, oh, there's also money, which is really
It's
interesting.
a cherry on top of the cake.
Exactly.
They're like, we don't pay for anything for these facilities, like STI. I mean, my blood has never been taken to the lab. My DNA, oh really, genetic makeup. You know, they all fascinated about this. Like, I'm getting money and I'm gonna know my status, you know. So it's like a cherry on top. So they really want to do it because they want to learn more about HIV, because they know that they are affected, even though some people don't know if they are infected or whatever. But most of the time, we are like, our protocol says that we should recruit people who are HIV negative and who do not know their HIV status.
That sounds like it's a lot of people who don't know their HIV status.
Exactly.
Yeah.
So tell me, you guys are young. You guys are, you know, from Durban, right? What is it like working with young people as a young person? What is it like doing that work? And what do you think is important for people to know when hiring young people to work on studies or in clinics where young people are being served?
Okay. I think it is good. Working in a setting like this, it's a good thing because it's encouraging you to look at yourself and then do things more different. And then when you tell people about things, you tend to apply them in your life also. I think it's a good thing.
That's a great point.
Yes. And in a way, I think like you also become like a role model to these participants, because even when you are walking on the road, you become familiar with them and they become familiar with you, and at the end sometimes they become attached to you. And another thing is, I think that working with other young people, it's fun, and you also get to learn a lot. They also get to learn a lot because, you know, firstly, when you ask them questions, I mean, the information that you're getting, you're like, oh, okay, some of my peers do things like these, and some of the things like you already know because you are also young. and that is why they're relaxed when they're answering you, because they're like, okay, some of them I would ask them questions and they're like, okay, I'm like, darling, just, you know, everybody's got their own skeletons, so just answer me. So they'll be relaxed and like, yeah, that's true, I don't know your skeletons, but anyways, let me answer you. So I think it's much better since we are young and they're also young.
Yeah, I think what makes them more relaxed is the fact that we are both male and female. I only interview males and she only interview females,
Oh,
which makes them more
Yeah.
comfortable to answer questions.
So I think also another thing that happens is that you're also able to do a self introspection, you know, to sit there and think, okay, this is what I'm asking people, but am I doing the right things? You know, you also get time to reflect on your own life to see this is what is happening, but also to see yourself through their eyes. I think it's something else. You know, it helps you in your own personal lives to sit there and look at yourself through their eyes and realize some of the stuff that is going on. I think there's a lot of cases that we're seeing as well in terms of, you know, there's cases where you wouldn't think they're still happening, like things like abuse, you know, physical abuse and sexual abuse among the group that we see. So there's a lot, because the questionnaire, the survey is actually, it looks at those kind of things, and we're asking them questions about those things. So when they start opening up on those things, then you get to realize that actually there's a lot of these things going around, you know, because you might think it doesn't happen in your community, but in other places it happens, and people just kind of feel normal, which I think it's a great idea that we have the social worker to help them through those kind of things.
Great. Overall, what would you say are the next steps for working with youth around HIV prevention in Durban and overall in South Africa as well?
I think what needs to be done, I think it's more using a youth-friendly approach, because of the facilities that we have here, we find young people coming in now and again. Even the people that we've enrolled in the study, they're coming back over and over again, you know, just to hang out in here. And you know, it's a good environment to hang out because it's a health related, there's condoms, there's everything, they can get the information that they are looking for. So you do find that people are looking, I feel that people are looking for the services. People do need these services, but it's because the services are not there or the way that they are being implemented. So if perhaps the government or the clinics were to approach more of a youth-friendly, then we'll see young people going, you know, to access those services, but it's because maybe of the way that they're structured that youth doesn't want to go there. So if you put them in the front and you make them special, then they'll always be coming in.
Great. You guys have any thoughts on that?
And to add on top of that, you find that, okay, we may have clinics and facilities in our communities, but it's not easy to go to those communities because, I mean, all of your neighbors are there, and perhaps even the nurses that work there are from your community. And so if you go and test there, I mean, and like if you're going into a certain room, they already know that, okay, this person is going for an HIV test. Already, if you have a small cup in your hand, they know that she's going for a pregnancy test, and they've already concluded that, okay, she's pregnant, even if they don't know the results. So, like, I think that's what makes young people, like, stops them from going to their own public clinics. And this is like a special clinic for them, because even if they are schooling here in town, or even if they catch the bus here in town to go back home, they can just come in and pop in. Even if they have an STI, they can consult our nurse, and everything is private and confidential.
Yeah, and I also think going forward, the AYAZAZI will affect the youth in a positive way, because we teach them about different things. We have a social worker who talks to them about their emotional well-being, and then it's also encouraging us, the AYAZAZI staff, to learn more about HIV so that we can deliver correct information.
And I also feel that, like, in our survey, because we also want to improve participation from young adults, for them to participate in research studies. So what I found that, like, most of the people, when I ask them questions from the survey, if they'd be willing to participate in a certain study, perhaps like whereby you have to document about your menstrual cycle. They say, yes, I would. Okay, a study about anal sex, or perhaps if we had to collect swabs from the anus, would you participate? They'll be saying, yes, I would. So it's very interesting, and I think that their participation will increase as time goes.
Wow, it sounds like you guys are doing amazing work, and you're doing work that has kind of never been done. And if it's been done, it hasn't been done this way. And so you're paving the way for something brand new. And I think it's very inspirational for the rest of the world as well. And I'm really excited to hear, and I know everyone else is too, really excited to hear what comes out of AYAZAZI. And thank you very much for sharing your stories.
Thank you.
Thank you.